Hi, my name is Richard Pillow. I'm a patient of Dr. Shen Garnett. I started thinking about getting Invisilign around 2 to 3 years ago. Finally, this summer, I quit talking the talk and started walking the walk. I took that leap forward and decided it's time to invest in my smile. And let me say that I couldn't have made a better choice with choosing Bella Smile Orthodontics or with choosing Invisilign treatment over braces. The Invisilign treatment was shorter, it was cheaper, and also I can carry on my daily activities without anyone knowing that my teeth are being straightened by these invisible aligners. I can already see a difference in my smile. It's only been, I want to say, a month. So these things are truly amazing. They really are the true alternative to braces. In the next few minutes, I'm going to explain and demonstrate how to remove your Invisilign retainers, how to care and clean for them, how to reinstall your Invisilign retainers. And then I'm going to go over a few proper oral hygiene tips pertaining to your Invisilign retainers. In addition, I'm going to end. In addition to that, I'm going to end with a few frequently asked questions that would be quite helpful to you, especially to a newly signed up Invisilign patient or a patient that just started their Invisilign treatment. And so follow me and let's begin. Hi, it's me again. Now let's get started. I'm going to start with the demonstration by removing my Invisilign aligners, but first there's a few things we should remember. Only handle one aligner at a time, and make sure you always wash your hands to prevent germs from getting in your mouth, and just to stay clean and be sanitary when handling these things, because they are going to be in your mouth. So that's the first pre-step. All right, so this is the first step, removing your aligners. Now this is very simple, but there's a few things that you should remember before removing your aligners. Please don't use any sharp objects. You can miss a poke your gums or damage your aligners. And if they don't come off easy, then talk to your orthodontist and see if they can do anything to correct that issue for you. And another thing is also you want to avoid unnecessary removal with these aligners. So first I'm going to show you just this simple 1-2 step on how to take out your aligners. And so what you're going to do is you're going to go to the back of your molars and basically peel the aligner around, all the way around until it comes off. It's that simple, excuse me. All right. It's that simple. It's that simple. All right, prior to cleaning your Invisilign treatment, there's a few things you should know. Don't use a denture cleaning kit or any of that material. They have some Invisilign cleaning kit, and it's about $50, I believe. That's recommended, but the cheaper version, which I do normally, just put a little toothpaste on the toothbrush, or when I'm done brushing my teeth and I rinse my toothbrush out, there's still some toothpaste in there, and when you rub it up, it's just like using it's still a small amount contained in the toothbrush. So that's what I do. So this next video is going to demonstrate me cleaning my aligners. Now cleaning these things are very easy. You're gonna want to make sure you have a little bit of toothpaste on your toothbrush. And what I do normally is I just use the leftover. It's normally some leftover when you rinse off your toothpaste after brushing your teeth, and you can use that. It'll foam up pretty good and clean really well. So that's what I normally do. But I'm going to demonstrate for you really quick. Now we're ready to reinstall our aligners. First, you want to make sure that you have the upper aligner for the upper jaw and the lower for the lower jaw. And that's indicated with, it should be on the back of your molars, on the, around this area, around the far back molars. It should say L or U, indicating for lower or upper jaw, and it should be followed by the stage number. Right now I'm on stage 3, so just making sure that you don't mix up maybe when you progress to another stage or whatever. Always make sure you have put your case, your Invisilign aligners in there. So now first I just put a little water in here. It makes it feel a little bit better and look better. And what you're gonna do is you're gonna place it, push up with your fingers right here in the front, middle, and then all the way to the back until it snaps into place, and it's good to go. And now I'm gonna do the bottom. Excuse me. And so there you have it. Just that simple. Now my Invisilign aligners are back doing their job, straightening my teeth out. Hi. Now I want to talk about a few proper oral hygiene tips. Whenever removing your Invisilign aligners, make sure that you floss, and make sure that you brush your teeth for about 3 minutes with a soft bristle toothbrush. Also, you only want to remove your aligners for drinking and eating. And you should only drink water while they're in there. So don't drink any other drinks or whatever. You don't want to compromise the integrity of your aligners with any ingredients or anything, and you don't want to discolor them or whatever. So just make sure if you do take them out that you just drink, eat your food, and then you make sure you brush and floss prior to reinserting them. Now it's time for me to answer some frequently asked questions. Some people wonder, will the treatment be painful? And initially, wow, my teeth, I could totally feel it. My teeth were they were really shifting. And now I say probably the first 5 to 6 days after each stage that I've done, I feel a little bit of pain and tension, but that's because my teeth are being straightened by the aligners and the series, that are gradually shifting them. And so, I kind of look at the model when I'm in pain and I'm kind of in agony, feeling agony and pain. No pain, no gain. So I know when I'm feeling pain, my teeth are getting straightened. If I wasn't feeling pain, then it wouldn't be working. Some people wonder, what if you lose or break an Invisilign? Contact your orthodontist, and they might suggest go back to the other one. I mentioned that earlier in the video, but I just want to cover it again just in case it skimmed by you. Some people wonder, will tobacco products damage your aligners? Absolutely. They'll make them dull and they won't look as nice and clear. So avoid doing that. Remove them if you have to, if that's something that you want to do or you do regularly, but you want to avoid removing them at all costs unnecessarily, because remember, you have to wear them 22 hours a day. If your Invisilign doesn't fit, if you're going to another stage and it doesn't fit comfortably on your teeth and it takes a while, or you have to struggle to get it on, make sure you contact your orthodontist to see if there's anything they can do to fix it. Don't damage your teeth, don't hurt yourself, and don't, try not to break your aligner, trying to insert them if they don't go in, within reasonable force. Some people wonder if they could chew gum. No, that applies. It's the same as tobacco and any other food. You got to take them out. Anytime you have your aligners in, the only thing you can drink is water. The only thing you can put in your mouth with them is water. So just remember that. That's the golden rule. Only water. And besides that, that's about all the questions. Thank you for tuning in. Thank you for watching this video. And I hope that this video, based on my Invisilign treatment and my experience this past month with me beginning my Invisilign treatment, has been a great help to you. And if you have any questions, feel free to email me, and I'll answer them and get back to you as soon as possible. And also to contact your orthodontist if you have any other questions or any other things that you need cleared up.